Imagine coming home to find your adolescent son's bluish body hanging in a closet. On the floor, there's a litter of pornographic magazines, a bottle of lotion, and several articles of women's undergarments. Unfortunately, this is the reality of a mother who came home to find her son dead. Now imagine 72-year-old actor David Carradine dead in a hotel room closet in an intricate web of ropes, one around his neck, the other around his genitals, with the two tied together. He was found in a Thai hotel. Unfortunately, both of these deaths are caused by autoerotic asphyxiation. Autoerotic asphyxiation is a form of autoeroticism where people restrict their brain of oxygen to produce a euphoria while masturbating. Practicing AA is a dangerous act of autoeroticism. Individuals have lost their lives while performing this solitary act. There is no specified safe way to perform AEA, and there's those who continue to practice AEA are putting themselves in grave danger. Unfortunately, this practice is becoming more popular amongst adolescent boys. Unfortunately, AEA is underreported. The victims of AEA are usually found by their family members. When they're found by their family members will often alter the scene. Also, underreporting is due to the ignorance of investigators. Investigators often conclude that practitioners of AEA their deaths are resulted as teen suicides, intentional teen suicides. AEA deaths actually represent a significant portion of the overall adolescent suicide rate. It is estimated that AEA death contributes to 6.5% of adolescent suicides and at least 31% of all adolescent hangings. AEA is most commonly practiced amongst males aging from 9 to 80 years of age. Little is known about AEA and their etiology. The earliest manifestation of AEA is known as the choking game, practiced amongst young school-age children. The euphoria is produced by pressure on the vagus nerve via the Heimlich maneuver. Researchers have noted an increase in lethality amongst young risk-taking adolescents who engage in asphyxial or the choking game, increasingly by using ligatures in solitary circumstances. The number of adult practitioners is unknown, much less the number of adolescents involved in asphyxial games. The total amount of people estimated to practice AA is unknown, due to the evidence only being available from accidental deaths. However, evidence has been able to give insight about those who participate. The participants are typically male, but sometimes females practice too under different circumstances. In Holmes' article, he states autoeroticism is predominantly a young person's practice. Keep in mind the statistics gathered are from accidental deaths. Practitioners of autoerotic asphyxiation are overwhelmingly of the white race. The family members and friends of those fatal victims of autoeroticism describe the practitioner as shy, introverted, and often have few friends and associates, and have few interests and hobbies. In this article, he also describes the practitioner as timid and shy around people of the opposite sex, lacking the social skills to interact adequately. This person is also an overachiever, devoting attention to detail with success in school and in the workplace. Practitioners of fatal AEA come from middle-class backgrounds. These individuals are involved in their community and school programs and have occupations of a professional in nature. This person appears to be intellectual. Ironically, practitioners are often churchgoers and are judged to be religious persons. However, this person has suicide tendencies. Now you may ask, how do we prevent people from practicing AEA? We need to be familiar with this paraphilia. And we need to be able to ID and discourage child-adolescent choking games that have the potential to progress to full AEA. We may do this by providing educational content to medical, nursing, and psychological curricula and for residents in primary care fields, psychiatry, and emergency medicine, informing them that the choking practices are capable of causing unconsciousness in 7 seconds with as little as 7 pounds to the carotid sinus or the carotid artery. We may also treat it with the reduction of the sex drive with an anti-androgen, such as medroxyprogesterone acetate, which has been used successfully. Selective serotonin reuptake inhibitors, amyl nitrate, and lithium carbonate have been used with modest benefit in some adult paraphiliacs who most often have attention deficit disorders or a comorbid mood disorder or OCD. In conclusion, keep in mind that practicing autoerotic asphyxiation is a dangerous solitary act that has the potential to cause death. Individuals should not practice this act because there is no safe way of performing this act. In order to refrain from classifying AEA as a suicide, we need to be aware of the signs of AEA. There are preventative measures to desist individuals from participating in AEA. Individuals who participate in AEA could be treated with medication or psychotherapy. With information provided to health providers and school educators, we can desist our children from practicing AEA and playing along in the choking game. Thank you.